Greetings, I'm Dr. Albert Mensah. Recently we had a wonderful webinar for members of the American Psychological Association. Our goal is to try to help explain to psychologists why some of their patients or clients might have some difficulties and why they're having challenges with healing. So we talked about the role of biochemistry. Now, we had such wonderful and great questions that we didn't have a chance to really sort of answer all of them. So we're doing this video to try to answer a few more of the questions that came through and to share some knowledge and some understanding with members of the APA as well as anybody who's out there and listening. So let's get right to it. Just got to have the readers here. The first question someone asked was, do contraceptives affect the biochemistry of women? Absolutely, without question. Now let me explain this. Somewhere between 35 and 45% of females are estrogen dominant females. That actually leads to increases in copper, and these same individuals can't get rid of the copper too terribly well, and that can prove to be toxic. Now look, those of you watching this, don't try to go out and chelate your copper. You're going to destroy yourselves. Copper is extremely potent. Leave it to a professional to handle the removal of it. Give us a call and we can talk about that, okay? But don't try to do this yourself. So, absolutely, contraceptives can affect the chemistry of women. And the next part of the question is, if so, in what way and what are the options? Well, so we just talked about estrogen dominance. What does that mean? It means that females can be depressed, they can become more anxious, they can have cyclical moods, they could have everything from structural abnormalities like fibroid tumors to endometriosis to chronic fatigue syndrome, more emotional difficulties. A variety of cognitive and physical and physiologic issues can be present with regard to females who fall in that 35 to 45%, the estrogen dominant variety. Okay? So that's a very big piece here. What are the options? See a trained practitioner, a skilled practitioner, who understands exactly how this works in order to have the copper regulated from the system. You don't chelate, you don't just rip it out. That can cause more harm than good. Many people have ended up in the psychiatric ward because of inappropriate treatment with regard to getting copper handled. So contraceptives can have an effect. It's roughly in about 35 to 45% of females. You're the ones out there, you know, you've tried them and you don't feel good on them. See a trained professional. Give us a call. Question number 2. Can you explain the chemical imbalances that may contribute to migraine headaches? Well, aside from hypoglycemia, which most people recognize, certain imbalances such as, oh, isn't this a surprise? High levels of copper, again, can contribute to migraine headaches. Number 3, what is the prevalence of mental health issues that can be explained by biochemical imbalances? Oh, I loved that question because realistically, anywhere between 85 to 95% of mental health issues can be explained by biochemical imbalances. And I know what you're thinking. You're thinking, well, wait a minute. What about all the traumas that happen? And what about all the people who are suffering from years and years and years of mistreatment and being raised in poor environments? I'm not talking about those people. What I'm talking about are the individuals who seemingly have no real reason to feel bad, and these problems erupt. But at the same time, I am also talking about the people who had horrible circumstances. Because what happens is that when you take baseline chemistry that is problematic, and then you add to it what we call epigenetics, how the environment affects genetic expression, now you've got a double-edged sword and a double whammy that can create big problems. And epigenetics has been running rampant for the last 50, 60 years in the form of how we work our environment, the stuff that we use, the food that we eat. And by stuff, I mean things like even prenatal vitamins beyond a certain point in pregnancy can cause problems because it's rich in folic acid. This can later predispose individuals to actual depression if you're what we call undermethylated. Oh, another chemical term, methylation disorders, all right? So there is absolutely a role somewhere in there for a good 85 to 95% of people in the United States of America and globally. There is a role for biochemical imbalances producing difficult lives, difficult outcomes. Okay. Well, now here's the next question, which is interesting. What role does epigenetics play in treatment plans? Well, epigenetics plays a tremendous role. This is where you have to have a skilled practitioner looking at your history, looking at everything you're doing to assess what might be the trigger, what are the damages produced by these epigenetic changes, and then and only then can you really look at a good, solid treatment plan to correct the issue. So this is not something that is for the faint of heart. This is not something for the typical person, even practitioner or even doctor to do. It requires a trained specialist. Okay. So the next question is, question number 6, what is the next step in educating psychologists and other mental health care providers? That actually holds the answer in the question. The next step is to train and to educate psychologists and other mental health care providers, and not in terms of treating these individuals, but in terms of recognizing that some of these conditions, in fact, many of these conditions, are not simply coming out of the random universe, that there are actual underlying causes, and to train these individuals to learn what the symptoms are that categorically go along with which particular biochemical imbalances. And then it becomes a matter of having a good relationship with a trained practitioner or trained practitioners globally in order to have your patients, your clients, go to the right people for treatment while you support them with good psychological help and help move them along and support them as time goes on. Now, question number 7, the last question, says, can you explain the mechanism surrounding postpartum depression? Absolutely, we can. And once again, it goes back to our very good friend, copper toxicity. Okay. Now, just to be very clear, Dr. William Walsh, PhD, and Dr. Judith Bowman, MD, were the ones who did the studies with regard to postpartum depression. And they determined that a good 85% of individuals who had postpartum depression truly had biochemical abnormalities at the root cause. So I'm going to put this out there. I don't want to call this the postpartum depression issue. I'm going to start calling it the Walsh-Bowman syndrome, aka postpartum depression. I've got to give credit to where credit is due. Dr. Judith Bowman is the leader in this field with regard to nutrient imbalances and women's health, in particular postpartum depression. So the Walsh-Bowman syndrome, I think, is something that we need to start paying attention to. And folks, it is treatable. It is so treatable, it's not even funny. But you've got to find the right practitioner, get the right help. Give us a call, we'll give you some direction. I'm Dr. Albert Mensah. Thank you for paying attention.